Live. We are live. We are live. I'm Dr. Frita. Welcome to Medical Monday. Oh my gosh. We have a power-packed show full of health topics in the headlines. We're going to start off with myth versus fact. Y'all know that's my favorite game. And we'll talk about Christina Applegate because she shared that she had a kidney infection that caused her so much pain. And so we'll do a myth versus fact segment on some of the signs and symptoms of kidney infection. What should you do? And then we'll move into your weekly dose, where I'll give you a fresh take on the hot health topics in the headlines you can't get anywhere else. We'll start off talking about Kelly Clarkson's ex-husband, who has now passed away from melanoma. We'll talk about the warning signs and symptoms of melanoma and what you should do if you see this very life-threatening cancer on your body or on the body of a loved one. And then we'll talk about Anthony Anderson. Yes, he's in the headlines again because he has King's disease. Oh, yes, I'm talking about gout. The doctors pulled 140 milliliters of fluid out of his knee. Let's talk about it. Gout is pretty common. Let's talk about the warning signs, symptoms, risk factors, and what you should do if you get a gout attack. Next, we will talk about this challenge. Raise your hand if you've seen that Nicki Minaj challenge. Looks fun, looks kind of carefree. It's not. There's actually an influencer who was doing the Nicki Minaj challenge and she broke her back. Yes, she fell and fractured her spine. So don't play. Let me tell you about this challenge, the dangers of it, and why you should stick to something else. And then we'll talk about a few more things in the headlines, including Teyana Taylor. She's on a comeback. She has an album that's coming out this month, but she shared that she actually had to have an emergency surgery on her vocal cords. We'll talk about the lesion that was on her vocal cords and the importance of the vocal cords, and especially for someone who's a singer, who's an actor, what they need to do if they have symptoms of a tumor on their vocal cords. Lastly, if we have time to talk, we'll talk about one more thing, NFL smelling salts. They've been banned, or have they? All right, I'm Dr. Frita. We've got a lot to get into. Let's go ahead and get this thing going. This is Medical Monday. Hello, hello. We're live. I'm Dr. Frita. Welcome to Medical Monday. Let's go ahead and jump into these topics. And please give us a like and a subscribe because I'm going to be giving you evidence-based medicine about the hot health topics in the headlines. I won't be doing it alone. Please come on up to the front of the stage. My co-host and office manager, Miss Shador.
Hey.
How you doing?
Doing good. How are you?
Doing well. Just running around in circles, Shador, because I have an empty nest situation, kind of almost. We took my oldest daughter back to college. She went back to FAMU this weekend. And then, of course, the younger two have started high school. And so during the days, I don't have anyone calling me, asking me what's in the fridge, asking me what to do, telling me they're bored. And while I complain about a house full of people, I actually like a house full of people. So now I'm all alone. But not really, because I have everybody who's here in the chat. How are you doing, Shador?
I'm doing pretty good. Thank you for asking.
Good, good, good. All right. Who was the first person in the chat today, Shador?
Person today was Marina.
Hi, Marina. Welcome, welcome. Listen, we're going to have a fun day. We've got a lot of hot topics to cover, and I want you to please participate like you always do, MedHeads. And hello to everyone on IG, on Facebook, and especially y'all on my replay crew, because I look to y'all to like us, to share us, and to keep the conversation going. So shall we jump right in, Shador?
Yes.
All right. Let's start off with my favorite game, Myth versus Fact. And this one is on Christina Applegate. You know her as an actor back with Love and Marriage, the Bundy family. Mm-hmm. And of course, she's been in several movies, several television shows. But lately, she's mostly been in the headlines because of her messy podcast where she shares how she's having a journey with multiple sclerosis. And so we're used to seeing her talking about her different medical complications. Well, now she's got a new medical complication, Shador. She went to the ER in the middle of the night because she had severe back pain, and it was from a kidney infection. So let's play this clip, and then we'll do some myth versus fact statements about kidney infections.
Back to my front is like in so much pain. I'm like screaming, and They ordered me an emergency CT at 2 o'clock in the morning.
Christina Applegate revealing her latest health battle landed her in the ER. The 54-year-old detailed the medical emergency on her messy podcast posted August 5th, with co-host Jamie Lynn Siegler recording the episode inside Christina's room at her hospital.
I get here, go to the thing, rigmarole. I'm like, I want to be admitted. I'm not listening to you guys. I'm staying here because I want answers. I want every test that you can possibly think of or ones that you haven't even thought of, and I want them done.
Christina searching for answers after enduring her painful symptoms on a cross-country flight, followed by a 3 a.m. trip to the emergency room for the actress, who's been using her platform to share her journey with multiple sclerosis.
From my back to my front is like in so much pain. I'm like screaming, and they ordered me an emergency CT at 2 o'clock in the morning. I went in and got a CT, and I had kidney infections. And so I'm here because of this kidney infection, and I have to have intravenous antibiotics right now.
All right. So she's got one more thing. I know she's going to be talking and fussing and cussing about that on her podcast, which actually she was. She ended up doing the podcast from the hospital. So, I mean, that's dedication. All right. So, Shador, let's get going with our myth versus fact statements. Myth versus fact statement number 1, put an M1 if this looks like a myth, put an F1 if this looks like a fact.
All right. Untreated kidney infections can lead to serious complications like sepsis or permanent kidney damage.
Okay. Can an untreated kidney infection lead to serious complications like sepsis or outright kidney damage? Put an M1 if that's a myth, put an F1 if that's a fact. All right, myth versus fact statement number 2.
People with diabetes are at higher risk for kidney infections, even if their blood sugar is well controlled.
Ooh, that's an interesting one. An M2 if this is a myth, F2 if this is a fact. Are people with diabetes at higher risk for kidney infections, even when their blood sugar is well controlled? All right, pencils down, pencils down. All right, do we have any takers, Shador?
Absolutely, Dr. Frita.
All right, for statement number 1.
Untreated kidney infections can lead to serious complications like sepsis or permanent kidney damage. So we have TS. Hello.
Hi, TS.
TS says fact.
Okay.
Planet Life agrees. It is a fact.
Hi, Planet Life. Okay.
Tisha says a fact as well.
Okay.
Anton also agrees.
Okay.
And our member, Ms. Rosalind. Hello.
Thank you for being a member. Hi, Ms. Rosalind.
She says it is a fact.
Okay.
And over
Does anyone think it's a myth?
Yeah, over on IG, we have Colleen.
Hi, Colleen. Welcome from IG.
She says myth.
She says it's a myth. You don't think that a kidney infection can lead to something this serious? Okay, like sepsis, like kidney damage, or really that serious. You think it's not that big of a deal necessarily, a kidney infection. All right, but thank you for watching on IG. What did I do for y'all this weekend? I did do some posts. Oh, I did a couple of posts. I did one post on the male birth control pill. Yes, a male birth control pill is being studied. And in the early clinical trials, it has no side effects, no negative side effects, and it looks to be very effective. But I also talk about some of the limitations of the study. So that's on IG and it's on Facebook. And on IG, I also posted, a clip of when I was on CBS Atlanta News First this summer. And so I'm talking about some information on heat-related illnesses. And specifically, I'm talking about a resolution that's been introduced in the Georgia lawmaking facility. So there's a House Resolution 393 that's been introduced to try to protect workers from heat exhaustion and heat strokes. So check that out over on IG. Got it on Facebook as well. All right. So should I read this statement for me one more time? This myth versus fact.
Yes. Untreated kidney infections can lead to serious complications like sepsis or permanent kidney damage.
All right. This is a fact. It is a fact. If a kidney infection goes untreated, then it can lead to the infection leaving the actual kidney itself and actually seeping out into your bloodstream, causing an overwhelming infection. You can literally get septic shock. I've seen it in the hospital, especially with my elderly patients. You know, they seem to be at high risk. And of course, immunocompromised patients as well, people who are, have chemotherapy, or if they have lupus and they're taking drugs that push their immune system down, then sometimes something that starts as a kidney infection can lead to overwhelming infection and sepsis. And yes, having kidney infections, especially if they're recurrent and they cause damage to the kidney tissue, they can lead to kidney failure. And so it's very important to know the symptoms and to not ignore the symptoms. And as we get into myth versus fact statement number 2, I want y'all to put what you think some signs and symptoms are of a kidney infection. And also, if you're really bold, med heads, put the difference between a kidney infection and then what we commonly call just a general UTI or a bladder infection. Yeah, I'm asking y'all all that. All right, let's move to myth versus fact statement number 2, please, Shador.
All right. People with diabetes are at higher risk for kidney infections, even if their blood sugar is well controlled.
This is a tricky one, I think. Did we get a mixed bag? Come on, Shador.
We got a mixed bag on this from Dr. Frita.
Okay.
All right. Marsh, hello.
Hi, Marsh.
Marsh says myth. I'm sorry. There is a myth.
Okay.
Faith agrees that it is a myth.
That it's a myth.
T Chosen, hello.
Hi.
Also says myth.
A myth.
The good one says a fact.
The good one says the fact that people with diabetes are at higher risk, even if the blood sugar is well controlled. Okay, this definitely is a nuanced one.
Mm-hmm.
Okay.
Mary agrees it is a fact.
A fact. Hi, Mary.
And Alice also says fact.
It's a fact.
Mm-hmm. And over on IG, the NP Anika says it
hey, the NP Anika. She gave us some good information last week. Welcome back.
She says fact.
A fact. Y'all better listen to the NP Anika because she's usually right, and she's right in this case. It's a fact. And so I think the trick on this question is that we know that patients with diabetes tend to have compromised immune systems, right? Which will put them at risk for infections, including a urinary tract infection or a kidney infection. But the trick here is that I said, even if the diabetes is well controlled, and truth of the matter, if you've had diabetes already, it can affect your immune system, and it can also affect your nervous system in the way that your bladder moves. So let's just say you had the diagnosis of diabetes, which means at one point you had high blood sugar. Even if now you've got it under pretty good control, yes, that can help to reverse a lot of things, but sometimes you may still have a lingering nerve problem in the bladder, meaning your bladder might not empty all of the way, okay? And if your bladder does not empty all of the way, then that can lead to a buildup or backup of urine in that bladder, which can lead to infection and a backup of an infection all the way up in the kidney. So that's the tricky part. When you have diabetes, I don't want you just to say, it's well controlled, I'm at low risk for all these things. No, you can still be at high risk for certain things, including a kidney infection. Okay. So did anyone comment on the signs and symptoms of a kidney infection, specifically a kidney infection?
Planet Life.
Hi, Planet Life.
Planet Life says UTI is a condition and not too serious with symptoms like burning sensations while urinating and etc. However, kidney infection could infect others like the blood or sepsis. Okay.
I'm glad you put it like that, because here's the truth of the matter is a UTI, because what you're describing, Planet Life, is a UTI as being like a bladder infection, right? Or a cystitis or a lower urinary tract infection. And we oftentimes use that term interchangeably. When we say UTI, we're talking about a bladder infection. And then when we say kidney infection, we often say we're talking about something else. But here's the truth of the matter on Planet Life. A UTI refers to a urinary tract infection, which is anywhere from the kidneys all the way down to the urethra, okay? And so your urinary tract system comprises of your two kidneys located in the flank, okay, or your lower back, the ureters, those tubes that lead from the kidneys to the bladder, and then also the tube that leads from the bladder to the outside world. So Planet Life, when we say UTI, we're not just talking about bladder, we're talking about all of the kidneys, the kidney system. And so a kidney infection actually is a UTI, just like a bladder infection is a UTI. And I'll tell you what you are definitely correct in. So assuming that you're using UTI interchangeably with the bladder infection, the bladder infections do tend to be less serious. Now, yes, they can progress, and yes, the infection can go and it can spread to the kidneys, but the bladder infections tend to be self-limiting, although treatment is recommendations. But by the time it gets to the kidneys, then oftentimes you have symptoms that can lead to more dangerous complications and sometimes even hospitalization. All right, so good. So all of the system is a UTI, urinary tract infection. A kidney infection or pyelonephritis is a type of UTI, and a bladder infection is also a type of UTI, but they're all UTIs. But the kidney one does tend to be more serious, more complications.
Mm-hmm.
All right. So what is a kidney infection? A kidney infection is when you get some type of a pathogen, like usually bacteria. Viruses can do it rarely, and it gets into your kidneys and causes issues. And I'll still hold on for y'all to give me some of the symptoms of kidney disease, some more of them, of kidney infection. So oftentimes you'll get this kidney infection when bacteria goes up through your urethra, that urine hole, okay, where urine comes out, up through the urethra, up to the bladder, keeps going up through the ureters, the tubes that take it to the kidney, and then you can get a kidney infection. Okay. When we're talking about a bladder infection, and again, we oftentimes use the terms interchangeably, but a bladder infection is a type of UTI, just like a kidney infection is a type of UTI. But a bladder infection is when you get the bacteria that kind of crawls up from the urethra to the bladder, and it hangs out in the bladder and causes inflammation, and you have an infection there. So in the case of Christina Applegate, y'all heard her. She said that pain was excruciating. She wasn't playing with them. She's like, order all the tests you know, order tests that you don't know, which they did. They did a CAT scan, and I'm sure they also did some urine work, urine culture, blood work, blood culture probably, and they found that she had a kidney infection. All right. Any takers yet on any signs and symptoms of kidney infection?
Yes, TS.
Hi, TS.
TS says a kidney infection can cause pain in the back radiating to the front, might cause brown to reddish urine, while UTI is very painful urination, can also have discolored urine.
Yes. And again, remember, UTI, it's all UTI. So we're talking about kidney infection. And I think that when you said UTI, you're using bladder infection and UTI interchangeably. It's what we do. But y'all know I'm a kidney doctor, so you know I got to be a stickler. So you describe kidney infection versus bladder infection, but they're all UTIs. So yes, so you can get, you heard Christina Applegate describe, she said she had pain that was in the back, moving to the front. And you can imagine, if you look at the path of urine from the kidneys, your kidneys are toward the back and your lower back, and the ureters take the urine up to the front. You think about when you have a full bladder, that's in the front, right? And so that's why oftentimes you'll get radiating pain with a kidney infection from the back where the kidneys are all the way up to the bladder where that infected urine is coming out. And yes, with both, with a bladder infection and a kidney infection, you can get cloudy, smelly, sometimes red, bloody urine, or it might look pink depending on how much blood is in there. Very good. All right. Anyone else?
Yes. The EMP, Anika, says flank pain, UTI symptoms, and fever.
Absolutely. Because that fever is less likely when we're talking about the lower infection with the bladder, right? But by the time it gets up to the kidneys, then yes, you can definitely get flank pain, and you can get a high fever. You can get sweating or diaphoresis, and you can even get signs of septic shock, meaning that the blood pressure can drop. You can get a dysregulation of your body systems, and you can really be sick with the kidney infection. Very good.
Limitless Sky.
Hi, Limitless Sky. Welcome back.
Painful urination.
Yes. And that can happen both with a kidney infection, and with the bladder infection. You can get dysuria or painful urination. Very good.
And T Chosen added chills to the list.
Chills. So you can get the chills and the fever, and that's getting into what we were talking about as far as having like that sepsis or overwhelming infection in the body. So yes, you can get chills and fever as your body tries to fight the kidney infection. Very good. And so I mentioned the path of the urinary tract, right? Where the bacteria can creep up through the urethra to the bladder, up the ureters. And I don't know, Shador, if you still have access to a photo that we had last week of the kidney system with the anatomy. If so, we can put it up. If not, then y'all can just Google urinary tract system or kidney system, and you'll be able to see it. But basically, in addition to bacteria being able to travel up through the urine hole, through the urethra to the kidneys, sometimes if you already have an infection in your body, like if you already have a bloodstream infection, then that bloodstream infection can go and infect the kidneys directly. And so sometimes the infection can start from the bloodstream to the kidneys without even going to the bladder. Okay. So there's a couple of ways that the kidneys can be hit. And so we talked about the signs, we talked about the symptoms. There we have it. That's what I'm talking about. The kidneys, and y'all see those two tubes, the ureters that lead from the kidneys. They go down to the bladder and then to the urethra. So when you think about the infections, we've talked about in the past how the bladder infections are more common in women. Why? Because they have a short urethra, right? There's a short distance from the bladder to the outside world. Whereas with men, there's a longer distance because you go from the bladder and that urine tube, the urethra has to go all the way through the male organ before it gets to the outside world. So you can imagine if bacteria are trying to climb up the urethra of a man, then they have a long way to go, and the man might just, urinate and boop, boop by bacteria. So women get those bladder infections more commonly. But given that the kidney infections can also come from the bloodstream, men can also get kidney infections as well. And so the treatment, antibiotics, oftentimes IV or intravenous antibiotics, which is what Christina Applegate had to have, and also rest, analgesics or things like Tylenol, acetaminophen to get the temperature down, NSAIDs like Advil, ibuprofen. Although I will say if you have kidney failure or CKD, you want to be careful about NSAIDs. Make sure you watch my video here on the YouTube channel, Dr. Frita YouTube channel, where I talk about 9 common drugs and medications that can harm your kidneys. NSAIDs is on that list. Basically, make sure you don't ignore symptoms of your body. Don't ignore back pain. Don't say, oh, maybe I just slept wrong. Oh, maybe I just kind of stretched it. Maybe I just have a crick in my back. If you're having back pain, cloudy urine, fever, chills, or anything leading up to that, do like Christina Applegate did. Go to the ER immediately, or at least call your doctor, go to urgent care, or if your doctor's able to see you on an urgent basis, go in to see your doctor because you want to find the kidney infection early. Early detection will help to prevent you from going into some of the complications.
Dr. Frita, over on IG, Talia, or Tales of a Woman, I'm sorry, just joined. Says, what about elevated creatinine?
Elevated creatinine. So yes, so that was part of that myth versus fact statement number 1. You can get elevated creatinine if you have kidney infection, okay, or pyelonephritis. And thankfully, if it's caught early, it's usually reversible. But yes, having pyelonephritis or kidney infection can lead to some kidney damage and an elevated creatinine or acute kidney injury, especially if you get a septic shock where you have the overwhelming infection that causes the blood pressure to drop. When that blood pressure drops, you don't get proper perfusion, proper blood flow to the kidneys, and you can get something called pre-renal azotemia, which will lead to elevated creatinine. So yes, that's a good point. When you're having a kidney infection, it can cause an elevated creatinine. Hopefully reversible as long as you catch the kidney infection early. That's a good one.
All right. Thank you, Dr. Frita.
All right. Now, let's get into our weekly dose where I give you a fresh take on the headlines you simply can't get anywhere else. And for those of you who are new to me, I am Dr. Frita. This is the Dr. Frita YouTube channel. We're also streaming on IG, on Facebook. Hey there, replay crew. And I'm very excited because here on the Dr. Frita YouTube channel, we have over 884,000 subscribers. So we're marching toward 900,000. And then I would like to get to 1 million, por favor, gracias. Okay. We can do it because what we're doing here is we're giving evidence-based medicine. And I share it with you in a way that's easy to understand so you can share it with loved ones. And if you're going to see a doctor, you can take a look at my hundreds of videos, okay, whatever the topic is, and it will give you a certain information, education, confidence, so that when you see the doctor, you can advocate for yourself or advocate for your loved one, and you don't have to worry as much as being intimidated by the doctor or talked down to by the doctor. It gives you some good information, okay? We give evidence-based information. So please go ahead and give us a like because we're giving evidence-based information here as well as a free way to support the channel. And while you're here, go ahead, give us that like and give us a share and send that we're on live to your friends in the group chat, in the WhatsApp, in the wherever, honey. Just go ahead and share the video. It really helps us out and it helps you to help your loved ones. All right. So let's talk about this weekly dose. We had some sad news. You know, Kelly Clarkson put a KC in the chat if you know who Kelly Clarkson is and if you've seen her all the way back from when she won American Idol. Okay. I've been with her since she won American Idol. My favorite song is Since You've Been Gone. Since You've Been Gone. Okay, I'll stop. But she's actually a very, very talented singer. She does have a talk show. And I love that in the beginning of her talk show, she reminds you who she is. And she'll get up there. She'll sing songs. She'll do covers of other people's songs. She's actually a true, true vocal talent. And so for those of us who've been watching her from the beginning, as far as, her coming to the public eye in American Idol, we know that she was married. She was married to a young man, and they had a bit of a tumultuous divorce. Okay. And I know there was, all kinds of controversy. She owned a house and he was living in the house, and they went through the court system. Long story short, the judge gave her the house, but then said that he was allowed to live there. There was just a whole lot of back and forth going on with them. And they shared 2 children together. Well, her ex-husband has now passed away from melanoma, and he was only 48 years old. Shador, do we have a clip of that?
Yes, we do.
Okay.
Some devastating news to report to you. Brandon Blackstock, the talent manager and ex-husband of Kelly Clarkson, has died at the age of 48. The singer revealing on Wednesday on her social media that Blackstock was ill, telling her fans that she was postponing the remainder of her Las Vegas residency to spend time with her kids and be there for her family. News Nation senior story editor Paula Froelich is here with the scoop on this story. I mean, Paula, this was not even 24 hours after she posted that to Instagram that he passed. What more are you learning?
Well, it's been going on for a while. He unfortunately was diagnosed with melanoma 3 years ago. Now, melanoma is an insanely aggressive skin cancer, and anyone who has had friends or family with melanoma knows it's very dangerous if you don't catch it very early. And unfortunately, this has been going on for 3 years now. People who read my newsletter know that he has been sick, because back in April, I wrote that that's the reason why she took 10 days off of the Kelly Clarkson show, because that ill, and she had to take her kids to really visit him and be there with him. And in between the show and the Vegas residency, she has been there taking care of him, having her kids around so that they can say goodbye to their father.
Yeah, that's really sad that he's only 48 years old. And it's interesting, because he's been in the media with him having a tumultuous divorce. And of course, we as the public know Kelly Clarkson more. And at least from the image we see, she seems like a really kind, really sweet person. And of course, this is just an image we see. So we hear all of these things kind of about him somewhat being villainized. And then now he's passed away. And of course, no one wishes, for anyone to pass away. So, of course, sending prayers up to her, to her kids, to the loved ones, to his family. We did talk about melanoma just last week. So I encourage you, after we finish this live, check out our live from just this past Monday, where we talked about the melanoma that Khloe Kardashian had. Okay, we talk about how to recognize melanoma. We talk about the ABCD. Okay, you look at the appearance, or if it has asymmetry, like a black mole. Okay, you look at the border. You want the border to be smooth if you have a mole. If it's all irregular or scalloped, that could be a sign of melanoma. You look at the color. A mole should be consistent, all brown, all red, all pink, all black. Whatever the color is, it should be a consistent color. If you have different spots of color, some blue, some red, some pale, the color changes could be a sign that you have melanoma. And also diameter. If you notice that the mole is growing, certainly greater than 6 millimeters, that could be a sign. So yeah, check out the video that we did, and make sure that you are seeing your dermatologist regularly, that you wear sunscreen. Of course, people who have fairer skin are at a higher risk of melanoma, but Black people can get it as well. We talked last week about some famous singers who are of African descent who've had it, including Bob Marley. He had melanoma. He had a different kind, acrolentiginous melanoma under his toenail. Black people tend to get that different kind of melanoma. We can even get it in our mucous membranes, like in the stomach, in the intestines, things of that nature. But as far as what you can prevent, especially if you're someone who has fair skin, if you don't have a lot of melanin, you want to make sure you protect your skin when you go out in the sun. Put on at least an SPF of 30. If you have really pale skin, consult with your dermatologist. You probably want a higher SPF. And people with black skin, brown skin, please put on sunscreen as well. All right. So yeah. And right here on the YouTube channel, I do have a video on skin cancer. So check that out, please, after you finish watching this live. All right. So let's move to the next topic. Please go ahead and give us a like as we move to this one. Oh my goodness. Anthony Anderson. If you are an Anthony Anderson fan, please put a double A in the chat and tell me what's your favorite Anthony Anderson movie or TV show. Okay. And I can tell you right now, mine is Blackish. And I like him in a lot of things like Law and Order, things he's done over the years. But straight up, mine is Blackish with Tracy Ellis Ross, because they say the quiet part out loud. And I find him to be quite hilarious. I also find him to be very helpful because he comes right up to the front of the stage and he shares when he has certain medical issues. And for this one, he shares that he has King's disease. King's disease, but honey, there's nothing royal about these symptoms. So let's play that clip and we'll talk about what King's disease is.
I'm on camera duty.
I love it.
Let me know when you're in, though, Doc.
Oh, you know Ian. Oh,
Yeah, it's yellow.
Oh, there you go.
there you go.
Oh, look at that. You need me to help you hold the
That's
syringe, Doc?
crazy.
You good.
Yeah.
The 20 cc's.
Boy, that's that much fluid in your knee, yo.
Oh, God. Jesus.
Yes.
Feels like too much.
Yes, so much. Yeah.
Oh, yeah, I want some of that. I'm going to put that in my collard
You
greens.
know what?
Yeah, we
That's so gross. Not gross what they're doing, but him talking about he gonna put it in his collard greens.
Yeah.
All right. So gout. Gout is what King's disease is. And put in the chat if you know why they call gout King's disease. A little trivia here. But Anthony Anderson has shared before that he has a diagnosis of gout. And gout is an inflammatory arthritis, okay? An inflammation of the joint, an inflammatory arthritis that's caused by a buildup of urate or uric acid. What happens is this. We all have uric acid in our bodies. Some people have more than others. And the uric acid is typically filtered by your kidneys. Okay, you get rid of the uric acid through urine. But if you get a buildup of uric acid and it goes to your joints, then that uric acid can turn to crystals in your joint. And it can be like shards of glass. Okay, it can be like shards of glass in your joint, which you can imagine can cause a lot of pain. And what happens when you get these shards of glass or the uric acid crystals in the joint, then that causes your body's immune system to kick in. And then you start calling all of these white blood cells, all of these inflammatory cells, and they show up, they cause fluid swelling in the joint. And so you get a lot of pain. Okay. And so that's the gout. Now, when Anthony Anderson first shared his story of gout, and we talked about it right here on Medical Monday, it was in his toe. He was like doing a scene in a movie, kicked the door and thought he broke his toe, but it was just gout. Here, he had a gout flare that was in his knee. And so I want to ask y'all a few questions as I continue to talk about gout. First off, if you were to wake up with a painful joint, would you rush to the doctor or would you just kind of sit and watch and wait? I'm just curious about how quick on the trigger you med heads are. Also, have you ever heard a celebrity story about health, like what we're talking about with Christina Applegate, with Kelly Clarkson's husband, with Anthony Anderson? When you hear these celebrities share their health problems, has it ever kind of triggered you to go take care of yourself? Let me know if it makes any kind of difference when celebrities share. Okay. But now let's talk about some triggers of gout. Let's talk about some triggers of gout. I'm gonna give y'all a second to put triggers in there. And you can share from a personal story or just what you know from loved ones or from being an NP or a doctor or a nurse or a healthcare provider. Okay. Shador, let's put that clip up, that photo of what a gout attack on the foot looks like. Okay, there you have it. So the great toe, the big toe, that's the most common place, but it can certainly occur in other joints, like what we just saw with Anthony Anderson, where he had 140 milliliters of fluid drawn from his knee. Y'all know that was painful. So it can be the toe, the knee, you can get it in the elbow, you can get it in the wrist, you can just about get it in any joint, but the big toe is the most common place where it happens, just like in this photo here. And when you get these crystals, as I described, the uric acid crystallizes, it feels like shards of glass, you get the redness, you get the swelling, and it occurs pretty quickly, okay? It's not usually a very long onset. It'll happen pretty quickly. And when it happens, if it goes untreated, the gout symptoms can last anywhere from 1 to 2 weeks. Fortunately, we do have treatment and we do have prevention, which I will get into. But let's talk about some of the risk factors for gout. So there's certainly some triggers and certain things that you eat, but just a risk factor can be if you have a family member who has gout, like a first degree member, a father, a mother, okay, a brother, a sister. And also if you're living with obesity, that puts you at a higher risk for gout. If you are someone with high blood pressure, with congestive heart failure, there tends to be a correlation with having a higher risk for gout. And then very importantly, the foods that you eat, because the way that you get this uric acid in your body is that when you eat foods that are high in purines, they are converted to uric acid. And if you have a uric acid buildup, you don't get rid of it the way you should through your kidneys, then that puts you at a high risk for gout. And yes, having kidney disease or CKD is something that can also put you at risk for gout, because your kidneys are responsible for filtering out excess uric acid. And so if the kidneys aren't filtering properly, guess what? You got a buildup of uric acid. And of course, I see that a lot in the office. And Shador, that's why so many of our patients have gout, because I am a board certified kidney doctor. Oh, and for those of you, yes, I am Dr. Frita. I'm an MD. I'm a medical doctor. I'm a board certified nephrologist, meaning I'm a board certified kidney doctor and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. And so that's why I like to come up here on Medical Mondays and talk to you about a wide array of topics. I literally read medical journals every single day. Love coming here to give you evidence-based information. So please go ahead and give us a like so we can continue to do so. You about to say something, Shador?
Oh, no. Look, they've been chiming in with their triggers.
Oh, let me see the triggers.
So,
and I'll tell you what makes me curious. Some folks will have triggers, but if it's their favorite food, they'll just battle through it, knowing a gout flare is coming up. You know that, Shador, because we see it in patients. We just had one Friday.
We just saw one Friday. And I'm like,
and if he's watching, he knows I'm talking about him.
I know
Enjoyed
that's right.
a good old steak, knowing that was his trigger, because steaks tend to be high in purines and some other meats also. What kind of triggers did they put in the med heads put in the chat?
Limitless Sky.
Hi, Limitless Sky.
Shellfish.
That's a big one for a lot of people, like shrimp. And it's so odd, but yeah, shellfish. So shrimp, oysters, mussels, eating these things can cause you to convert those purines to uric acid, and it can lead to a gout flare. I have a whole lot of shrimp lovers with gout, and they are mad at it. Very good.
Marina has a few that she listed: red meat and seafood.
Absolutely.
Sugary drinks and alcohol.
You got come to the front of the class. You got it, because all of those aren't obvious. Okay, so the red meat, I think a lot of people know. And remember, we call this King's disease. So different rich meats, like red meat, the steak that our patient was tearing up and knowing he was going to get a gout flare. So yes, red meat, animal meat can certainly do it. Pork, sausages can trigger. And then you mentioned the sugary drinks. So table sugar and also drinks that have high fructose corn syrup can lead to gout attack, because this fructose corn syrup, these sugars, these sugary drinks and products can convert to uric acid. So for those of you out there drinking up all kinds of fruity drinks and wondering why you're having gout flares, that's why. And then alcohol, high alcohol consumption, or even moderate alcohol consumption can lead to gout flares, because alcohol actually slows down the kidney's ability to convert to filter the uric acid. Okay. And so instead of the uric acid being filtered properly by the kidneys, the alcohol is like, nah, slow it down. And so you have more uric acid in your bloodstream, which again leaves you vulnerable to it crystallizing in the joint. A lot of people don't know about the alcohol or the sugary drinks. So yeah, come on to the front of the class. You get a gold star.
Tisha shared that her former supervisor trigger was fried foods. She had in her feet and she could not wear shoes. The pain was so bad.
See, it's true. Someone with a gout flare, and if any of you have gout, you know it, or if you've witnessed it, they don't want socks to touch their feet. They don't want sheets to touch their feet. And I've had grown men cry. My grown macho men have cried like babies with gout. It's an excruciating pain. And so, yeah, eating fried foods. I'm curious to know what foods she was frying, because if she was frying certain fish, frying shrimp, frying ribs. Yeah, people fry ribs in the South. These things can certainly trigger gout attacks. And so we're going to talk about some treatments as well. I'm seeing if we have any more triggers, and we'll talk about some of these treatments.
I remember Miss B
Hi, Ms. VE.
B Wellness.
Oh, yay. Thank you for being a member. And listen, for everyone who's listening, you can be a member as well. We have a members only live Q&A every month where instead of me spending the hour talking to you about the different headlines, we just talk about your different medical questions, health issues. We could drop a link. You come to the stage. We go back and forth. You ask me a question. You ask me another one. You ask me another one. And so for all of this medical learning and knowledge, all the learning that I like to do and the way I like to stay up on evidence-based medicine, you get a closer contact with me if you are a member, and we do the live dedicated to going over your health questions about you or your loved ones. So please join that membership. Okay.
Ms. B, soda, red meats, chicken, and game meat.
Oh, yes. So soda, we talked about that with the high fructose syrups, and then game meat. So things like venison, even lamb, some of the kind of wild meats and things that people catch, especially down here in the South. Y'all know, y'all who go hunting for deer and venison, you eat those game meats. Those have high purines, which your body converts to the uric acid. So I'm glad you said that. What else was there? Sodas, game meat?
Chicken.
For some people, chicken can do it. Organ meats can do it well. I'm talking about if you eat liver, things like that. If you eat liver, if you eat kidneys, then that's a big way to trigger gout in a lot of people. I think we hit on the bulk of them. Anyone else?
No, that's pretty much everybody saying it's the same thing, the rich meats. And we had one patient out with apples. Strange.
That was the strangest one to me.
Right?
Yes. The apples. So apples are a trigger for some people. Cabbage can be a trigger. So if you have gout, you'll figure out what your trigger is. But here's what's really important. There are ways to prevent it, ways to treat it. So a big way of preventing it is, yes, watching what you eat, trying to avoid some of these triggers we talked about, like the game meats, the alcohol, shrimp, if that's a trigger for you, steaks, if it's a trigger like it is for our patient from last week, try to avoid those. But also there are medications that can help to keep your uric acid down, like allopurinol, and then also Uloric. And I tend to use Uloric because that tends to be better for my kidney patients. Also probenecid. So keeping that uric acid level down. And if you keep that level less than 6, then you're less likely to have a gout attack. But what happens if you're trying to keep the level down, but you mess around, you run up on a trigger, you have an attack anyway? There are certain medicines like colchicine, which can help to prevent a gout attack. And so the way the colchicine works is you don't take the colchicine every day. And actually, if you're taking it every day and you have CKD or kidney disease, it can actually be harmful to your kidneys long-term and in high amounts. But even if you do have CKD, consult with your doctor. But for my patients, if they feel the flare coming, I give specific instructions on how to take the colchicine within the first 24 hours for sure, but the earlier the better. As soon as you feel the attack coming, you take the colchicine, you take some at one designated time, you take some at another, and that can slow down the attack, because what the colchicine does is it stops all of those inflammatory cells from rushing to that joint, causing that swelling and fluid, okay? So the colchicine is not necessarily dealing with the uric acid level, it's dealing with all those inflammation cells where you really get the redness and the swelling. Consult with your doctor, or if you want to talk about more about this to me, then I do offer a telehealth concierge service where, yes, we talked about the members only, where all the members can come and we talk. But if you just want something that's one-on-one, where HIPAA is in effect, I offer a telehealth concierge service where we do a telehealth meeting. I get all of your history. We talk your labs. We talk about your imaging. And just one-on-one, I give you medical information on your personal health topic, and I can talk to you from anywhere in the world. So make sure you click the link in the description, or you can always go to my one-stop shop, drfrita.com. All right. So that is very good. So we've talked about the treatments. So the prevention of gout, diet, plus taking the medications like Uloric acid and allopurinol. We talked about the colchicine for preventing an attack when it comes. Also, in some cases, prednisone, a short course of prednisone can get that inflammation down if you're having a gout attack. And the significance, and then pulling the fluid off of Anthony Anderson's knee, 140 milliliters. So yes, to relieve him of some of that pain, okay, and pressure he was feeling in his knee, but also to diagnose. They would look at the liquid under the microscope, and they would see uric acid crystals to confirm the gout diagnosis. But had that been bloody discharge or cloudy discharge, then it's possible that he could have had an infected joint or a septic arthritis, or he could have had something that was traumatic, like had he, broken a blood vessel or actually ripped something in his knee joint, he could have had a bloody discharge, like a traumatic arthritis. And so it's important to actually get that fluid and see what it is, which is what they did. And his was gout. Anyone say why they call it King's disease as we keep on moving?
Yes. Let me go back to my comment here.
Okay.
Jordan, a lot of people are saying because it was the rich man's food, expensive meats they were able to afford.
Exactly. And specifically King Henry, I believe King Henry VIII, the same person who's in the lineage of Prince Harry and all of those, he had gout. And he, of course, had access to the rich meats, the game meats, the sausages. And so he would get gout. And so they would call it, like you said, rich man's disease, because you had all this, you had to have some money in order to be exposed to all of these highfalutin rich meats. So called the King's disease. King Henry had gout. Check out my video on gout right here on the Dr. Frita YouTube channel after you finish watching this video. Let's move on to our next topic, shall we? Y'all don't forget to hit that like button and share. Let them folks know we're here. We're here. Get used to it. All right. What should we talk about next? I think we should talk about the Nicki Minaj challenge. Shador. Put an NM. If you have heard of the Nicki Minaj challenge, where folks have been wearing stilettos, some super high heel shoes, and balancing on tiny little surfaces on tables, and and having their legs crossed, sitting down, a very difficult balancing move. Have y'all seen the Nicki Minaj challenge? I saw it, and I'm gonna tell you the truth. It does look intriguing because it really does take a lot of body control and strength to do it. So it's kind of a flex for the flexible people who are strong. Yeah, let's play this clip of someone who's done the challenge.
Yeah, this is her doing it. I'm not gonna play the audio, but she's doing on about.
Yeah,
I see more people crossing more closer to the ankle or calf if they possibly can.
So that requires a whole lot of strength and a whole lot of balance to be able to do that. But it's not all fun and games. Okay, it's not all fun and games, because Shador, there is actually an influencer, a Russian influencer, who was doing the Nicki Minaj challenge. She had a saucer, she had a tub of baby formula. She looks like she's fit, in shape. She had on her stilettos. She was doing the challenge. She fell and she broke her backbone. Okay, she fractured her spine. Let's play this clip.
All right.
Nicki Minaj Stiletto challenge. Maybe don't. This influencer, Mariana Vasuk, fell and broke her spine after trying to balance on a tub of baby formula and a saucepan on her kitchen counter. Of course, the whole thing was caught on video, which she later posted to social media. In a since-deleted caption, she wrote that she had sustained a compression flexion fracture as a result of the fall. The TikTok trend Vasuk was trying out was inspired by Nicki Minaj's pose in her music video for High School, which is 12 years old. But now it's totally taken TikTok by storm. I mean, this video of a nail salon worker balancing on 2 bottles of nail polish has over 60 million views. Thankfully, Vasuk wrote in a follow-up post that she's doing great, following the guidelines, and thanks to her popular video, living in star status.
I want y'all to put in the chat, what do you think is the craziest or most dangerous TikTok challenge you've seen? I'm actually scared to mention some of them because I don't want people to do it. I don't want people to do it. But yeah, let's talk about this one. Because I'll tell you, I thought that was kind of cool. And I was like, And I even contemplated, let me go stretch, do a little piece of yoga and see if I can do the challenge. That's the thing. You always kind of wonder, if you can push your body. But now that we see that she had a fracture of her backbone, I know for sure I will not be doing the challenge, and I will discourage other people from doing it. Let me know, for any of you in the chat, if you actually did the Nicki Minaj challenge, okay? Or let me know if you thought about it, and now that you see this, you're like, nah, forget it. All right, so let's talk about the injury.
What's that? IG, someone from Alita from IG.
Hi.
She said, I did it, but I didn't have on heels.
Okay, didn't have on heels. See, that's what I call common sense. Common sense, because of course, if you're balancing from this hill, child, it's hard enough for me to walk with heels on just a flat surface. Child, it's hard enough to walk with wedges, much less balancing off of all these cans and bottles and saucers. Okay, so if you didn't have the heel, then at least that would have given you some support. I still don't encourage people to do it. We don't want any broken backbones, but not doing heels definitely would have given you more support. And so that was definitely a brighter, more injury preventive way to do it. Okay. All right. So she had a fracture. Okay. She broke her backbone. And the kind of fracture that this Russian influencer had specifically was called a compression flexion fracture. And the compression part of the fracture means that there is a force that's pushing down on the backbone or the vertebra. That's the compression part. And then flexion part of the fracture while she was flexing her back or she was bending forward. So it was the compression flexion fracture. And let's pull up the photo of what that fracture might look like, Shador. Okay, so here we have some vertebrae. Okay, your vertebrae are your backbones, right? They stack up on your back all the way from your neck, your cervical vertebrae, to the middle of your chest, your thoracic vertebrae, down to the lower back or your lumbar spine. And so you have these stacks of bones. Each one is your vertebra, okay? And they really provide protection to your spinal cord, right? They surround the spinal cord and stability in your back, and they allow you to rotate and to move. Okay. So here on this picture, you're looking at a side view, and where you see the redness in the fracture, that's the front part of the spine or anterior, the part that's closest to your stomach. And then on the right side, where you don't see the redness, that's the back or the posterior part of the spine. So in a case where you have a compression flexion fracture, like this influencer had after doing the Nicki Minaj challenge, what happens is when you get the force that's pushing down on the spine, and it also causes the spine or the backbone, the vertebra, to bend forward, it causes there to be a break in the front of the spine where you saw that redness. And then instead of the spine kind of looking like a rectangular shape, it bends down and it gets more of a wedge shape. Okay. The good news is that the influencer shares that she's doing fine, that she didn't have any issues. But can y'all put in the chat what y'all think some complications could be if someone is doing if they break their back, if they have a fracture of the backbone or a vertebral fracture? Put what you think some of the complications might be. Yeah, and while they're doing that, did anyone put in?
Already commented.
What you say?
On your thoughts, she said people have been saying that she is paralyzed. Is that true, or have you heard anything about that?
What I heard, and I've only heard from social media. Okay, of course I don't know her at all, but the report that I heard was that she was doing fine after the fracture. Okay, if anyone can find any information in the chat, anything that looks like a reputable source or a journal article, please put that there. But the last I heard was that she was doing fine. And I'll tell you, which leads to what you just said. Paralysis is a complication that someone can have from a vertebral fracture, okay, or a backbone fracture. Okay, if you get, especially, there are different kinds. So in her case, it was compression flexion fracture, but there are some burst fractures where you get multiple breaks or fractures in the front, the back, different parts of the spine. And when you get these multiple breaks, then the pieces of the backbone have a greater chance of damaging your spinal cord, which could lead to paralysis or to numbness. Okay. Mm-hmm. You can also have some dislocation of the spine, which could also push dislocation of the backbones or the vertebrae or the backbones, and that can cause some pushing against the spine. That's something that could cause a paralysis or a tingling. In her case, with that compression flexion fracture, where you just kind of have the front part of that backbone with a wedge shape, oftentimes you just have to wear a back brace, okay, and really stabilize your spine until it heals on its own. Oftentimes with the kind of fracture described with this influencer, surgery is not necessary. Okay. But if she were to have certain symptoms, okay, then they may need to revisit and do surgery or do procedures. Some procedures, you can put like a cement-like material to kind of build up the fracture where it occurred in the front of the backbone. Anyone else comment on what some of the serious symptoms could be in a back break?
Planet Life says walking problems.
Walking problems. So yes, if you damage your spine in a place where the nerves that affect your legs are involved, it can cause walking problems.
Alita from IG says long-term pain.
You can get chronic pain if you fractured your spine, it fractured your backbone. Okay, vertebral fracture. Good.
T Chosen says nerve damage.
Absolutely, you can get nerve damage, and you can specifically, T Chosen, get nerve damage to the nerves that help to innervate or supply your bladder and your bowel. And this could lead to bladder incontinence or bowel incontinence, okay? Having a leaky bladder or having bowel movements on yourself. If you have any of those things after an injury or back pain, you're noticing that you can't catch it when it's time to use the restroom, you're having bowel movements on yourself, leaky bladder, that's an emergency, okay? And also, you know, if you're having trouble walking, tingling in your legs, numbness in the area where you sit down, okay, around your anus, around your rectum, around your front genital area, any kind of a numbness, tingling, that's an emergency, okay, to go to the doctor, especially if after you've done something like the Nicki Minaj challenge, or if you had a fall, certainly if you had a car accident, if you had any kind of a trauma, those are the types of symptoms that should send you to the emergency room. Okay, anyone else?
Yeah, you and Limitless got touched on it. TS says partial or total paralysis.
Absolutely. Yes. Thankfully, at least from what I heard, that is not what happened to her. And with that type of fracture, that's not common. That doesn't mean it's not impossible. But yes, more like those burst fractures where the entire vertebrae, front and the back, have been affected, you get a high risk for having the paralysis. And mainly I'm talking about the lower back here, right? The lumbar spine. But what happens if you get a big fracture up high, like the cervical spine?
Mm-hmm.
You can get total body paralysis or even death, lose the ability to breathe in, to breathe out. And so we need to be careful about these challenges. And I don't know, it probably is far back up in the chat if anyone put any of the craziest TikTok challenges or dangerous TikTok challenges they heard. But the point is, it's just to be careful. If something seems like it's a bit out of reach or dangerous, just use your common sense and please avoid the challenge and discourage other people from doing the challenge as well. Stilettos on a tub of baby food, saucers, it not a good idea. And I know we've seen people who have done similar things and the stiletto challenge, and they've done well, but at what risk? So we definitely just need to be careful. Okay. All right, Shador, what shall we talk about next? So we've talked about Anthony Anderson, and we've talked about Kelly Clarkson's husband, and we've talked about the Nicki Minaj challenge. Let's see. Teyana Taylor. She has been, she stays in the headlines, I believe, with her husband or ex or estranged husband now. We know that she's a singer. We know that she is an actor. And she has a new album that's coming out. It's supposed to be coming out this month. But guess what? She's been having trouble with her voice, and she ended up having to have an emergency surgery on her vocal cords. So we have a clip for that, Shador.
Yes, we do.
Okay.
Teyana Taylor shares she's undergoing emergency surgery. The singer shared on August 6th that she'll be undergoing emergency surgery on her vocal cords to remove a benign growth. She wrote on her Instagram story August 6th, "I've been quietly dealing with some vocal challenges for a while now," explaining that doctors found a non-cancerous growth on one of my cords that's been messing with my voice and causing real discomfort. She continued, "Thankfully we caught it and it's treatable, but it does mean I need to pause and give myself time to fully heal." While Teyana has canceled her upcoming appearance on Michelle Obama and Craig Robinson's IMO podcast to make time in her schedule to recover, she hasn't moved the August 22nd release date for her fourth studio album, Escape Room. 34-year-old wrote, "It's the most personal body of work I've ever created. Just as I was getting ready to finally share this with you, life handed me my own unexpected escape room. One I didn't ask for, but one I now have to find my way out of with patience, rest, and faith, vowing to return with even more fire, more purpose, and the best version of me."
All right. Wishing her the best, wishing her healing. Yeah, very specifically, when you are a singer, you need your voice to work. So when you get these vocal cord, either tumors or vocal cord nodules, vocal cord cysts, vocal cord polyps, then that can really be life altering because it can affect your career and it can make you lose your voice. So let's talk about the vocal cords, what they do. And I want you to put in the chat, have you ever lost your voice, either from an illness like having a cold or from screaming and hollering? Okay. Have you ever lost your voice, and how did that affect your life? Are you a singer, or were you not able to go to work, or were you not able to give a speech? Were you not able to teach that day? Let me know if you've ever lost your voice and how it affected you. Let's pull that back up, Shador, the image of the vocal cords. So your vocal cords are located in your larynx or your voice box, as you can see here. And they're literally two cords of muscle. And what they do is they vibrate as air passes over them, and that helps to create sound. Where they have a very fast vibration, you get a high-pitched sound. When it's a slower vibration, you get a low-pitched sound, and you're able to control how the vocal cords manipulate the air that passes over them with your mouth, with your movements of your mouth, with your tongue, and you can help control how the air moves over your vocal cords, which is, of course, what singers do, and even what we do when we're speaking in high voices and low voices and all of that, okay? So they're pretty cool. Well, the problem is that you can get if you just look at those vocal cords. It kind of looks like a V there or upside down V. You can get a polyp, which kind of looks like a blister, or a nodule, which maybe seems like a little scab, or a cyst, which kind of looks like a fluid-filled connection. These are benign, okay, non-cancerous. They're benign, but if they're affecting your voice, like they were with Teyana Taylor, a singer, then surgery is recommended. Okay, in her case, it's a career situation. And so she had the surgery, and prayerfully, she will heal quickly and she'll be able to get out and promote her album. But yeah, so that was her emergency surgery. It was a non-cancerous lesion, not cancer. All right. Did anyone comment on if they've ever lost their voice?
Yes, Faith.
Who?
Faith. She says from screaming.
From screaming. Listen, it could be, you know. I've lost my voice, like in undergrad, screaming at parties, chanting at games, things of that nature. It's so crazy. But yeah, I don't like losing my voice. I like to use my voice. And from being sick or like having a cold, I've had strep throat before. Boo. Didn't really make me lose my voice. It made it hoarse. But I'm trying to think, if I lost my voice, what would be the most upsetting to me? Well, I wouldn't be able to come here on Medical Mondays. That would bug me. Couldn't talk to my patients. Yeah, and I've had my voice that's been really hoarse, so I've had to limit how much I talk to patients and write notes. I don't think that's happened since you've been with me, Shador, and you've been with me 12, 13 years. Have we hit 13?
13 years.
13 years, y'all. She's been my office manager, my practice manager for 13 years. But I think what would really bug me, Shador, if I lost my voice, I like hollering my kids' names out, and I just think it gets under their skin. Like I'll be like, Gregory, and he knows he has 5, 4, 3, 2. Gregory, before he hears it again. I know it gets under his skin because he's probably thinking, oh, did I take the trash out? Did I walk the dogs? Let me get off this video game. I hope she doesn't make me get off the video game. I'm sorry, y'all. Do I need counseling for that? But I just know when my kids hear my voice hollering their name, it drives them bananas. I would miss that. Okay.
Alita shared Dr. Frita on IG. She said, I scream a lot. I feel as of today, I pulled something that's God telling me to shut my mouth.
Oh, oh my goodness. I hope you're screaming and laughing and having fun and not hollering at people. I hope you're not hollering at your kids like I be hollering my kids' names. I definitely hope that your voice gets better. I hope your voice gets better. But yeah. Sometimes Mother Nature will tell us, or science or physiology, when we need to take it down a notch and when we need to stop hollering. My kids are like, Mama, why are you so loud? Like even when I'm happy, I'm loud. That's not gonna shock y'all who watch this.
RR says no, regular mom, you don't need counseling.
Thank you. Be hollering. Gregory, I told you to take this trash out. Avery, you do them dishes. Oh my gosh, I need to stop. But yeah. But yeah, if you lose your voice, you might need to take it down a notch. Real good. All right, we'll be closing up in just a minute. I will mention this last topic just so we can keep the chat going, keep the comments going. It's with the NFL smelling salts. Shador, do we have a clip on that?
Yes, we do.
Okay.
Why do athletes sniff smelling salts? Typically, it's used to treat fainting victims because of its strong smell. But athletes have used it for many years to provide a jolt of energy or alertness on game day. However, now it's banned. And a frequent user of smelling salts, George Kittle, isn't happy about it.
Our team got a memo today that smelling salts and ammonia packets were made illegal in the NFL. Wow. And I've been distraught all day.
But why is it being banned? Well, the NFL says the products are not proven to be safe and can also mask signs of a concussion. And so no ammonia, inhalants, and smelling salts can be used at all during the 2025 NFL season. Some players will now have to find an alternative to getting that much needed boost.
All right. So I want y'all to keep this conversation going in the comments and put NFL in front of it so that anyone who's looking and wants to participate, so that they know. And my question is, do you think that it's good that the NFL has banned smelling salts, or are they doing too much? And as I mentioned, it's ammonia. You get ammonium capsules, you breathe them in, and that helps to give the players a jolt. Okay, it kind of irritates the nose a little bit, irritates the lungs. Some say it causes them to take some deep breaths in. If ever they've been knocked out on the field, sometimes I'll get these smelling salts, this ammonium, and it'll kind of wake them up. And so what's being said by the NFL, the powers that be, is that it can mask concussion symptoms. Okay. If someone's really knocked out, but you give them smelling salts and they wake up, they're saying it can mask the symptoms. But with some of these new no-go symptoms, if they pass out in the field, even if you give them smelling salts, they're still banned from the game and have to get a full neurological evaluation. Some people say that before they do a drive or a big play, they do the smelling salts to get them going. But tell me, is the NFL doing too much? Are they worrying about the wrong thing? Like who they allow to be owners versus who's doing all the playing and all the work? Are they worrying about the wrong thing with the smelling salts, or do you fully agree and support the banning of smelling salts? I will say, I believe that if you're an individual player, you can take your own, but the NFL as a team, as an organization, is not going to provide the smelling salts. So put that in the chat. Let's have in the comments for NFL, and make sure again, as we get ready to close out, that you give us a like, give us a subscribe, give us a follow. Again, I am Dr. Frita, as you know, and we are almost to 900,000. We're up to over 884,000 subscribers here on YouTube. So please give us that subscribe. Make sure you share this information with the people you care about, because we do give evidence-based information in a way that's easy to understand, right? Y'all understand? Do you understand the words that are coming out of my mouth? Y'all understand what I'm telling you? And so it really does help people with their health and to advocate. So make sure you share. I do have some new videos coming out. And if you're a member, you'll usually get a first look at my videos. Okay. I got a real exciting one that I'm going to film that one. I'm going to like it. Also, make sure, again, you go to my one-stop shop, drfrita.com. There you can purchase my book, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about not only traditional medicine, but I also talk about holistic, natural ways to lower blood pressure, using food as medicine, deep breathing as medicine, meditation as medicine. Okay, so make sure you check out that book and check out our podcast, Healthy Happy Life with Dr. Frita. And so instead of just watching our faces on this video, you can actually listen to us while you're folding laundry, walking the dog, taking the trash out. So you can get it right there in wonderful audio. And when you go, please make sure you give us a 5-star rating if you enjoyed the information. Spoiler alert, you're going to enjoy the information. And for any of my television appearances, check out my playlist right here on YouTube, where I talk about the different national news shows I'm on, like News Nation. I've been on The Griot, Revolt TV, the Emmy Award-winning Paternity Court. I'm going to post one this week of when I was on CBS Atlanta News First. I'll be putting that in the television appearances. But again, I thank you for your support. Shador, as always, I thank you for being a wonderful co-host and practice manager. We'll go ahead and slide on out of here, and I will see you next week. Same bat time, same bat place. And thank you for making Monday your healthiest day of the week.